Good morning to you, Desiree, and your viewers. And in fact, we are fortunately right at the entrance of the Hani Baragwanath Hospital. I'm just going to move out of shot just to show you the type of procedures that are actually transpiring here at the entrance. As you can see, security is there. And in fact, those that are coming to visit who are not officials have their own designated entrance where in fact their cars are being checked, their boots are being checked, and just to ensure that, they are entering with no dangerous things or weapons that could be inside their cars. In fact, even the cars that are coming outside also, they are closely monitored. So from our experience actually entering this morning, we can safely say that definitely security is tight. But when we started engaging with some of the employees that are working here off the record, they started explaining to us that, there are officials that actually work with some of these cables. As you rightfully mentioned in your intro, that there was a 10-meter long copper cable that was stolen, endangering the lives of about 23 patients that were in an operating theater, 19 of whom were actually dependent on these ventilators to be alive. In fact, resulting in the health MEC also saying that, charges of attempted murder should also be leveled against the culprits once they are found. We know that the police are investigating those two incidents that happened, and in fact there is quite a concern to say that in 1 week such incidents that endanger the lives of so many people happen so easily here at Hani Baragwanath. But based on our observation upon entering the premises, we can definitely assert that security is there, but it seems that there could have been some sort of an alleged inside job, because according to the reports, this particular room where these cables are situated, any layman would not know where they are situated. It would have to take someone who actually works at this particular facility in order to know where to locate stuff like copper cables and the likes, and resulting in the lives of people being endangered in the process. Desiree.
Ofentse, let's speak about today's event. What's expected, the purpose of this inspection by the Gauteng government?
Well, the Human Settlements MEC is coming to inspect the extent of the damage, as you rightfully mentioned in your intro, and they will try to sort of mobilize some resources to ensure that, the situation is tightened or the security is sort of beefed up in terms of facilities that might be carrying your copper cables and the likes. And in fact, they will be briefing us as to how they will be operating, the alternative measures that they will put in place to ensure that they can avoid a situation like this. I mean, it would have been a disaster had those patients, some of whom they are saying, they could have been affected by the lack of oxygen during the time when they were being transferred from the two operating theaters that had a lack of oxygen once these cables were stolen. So we understand that they're going to try to come up with plans to avert the repeat of events of this week where there were two incidents of theft at this particular hospital, Desiree.
I don't know if you've had the opportunity to speak to patients and just finding out if they're feeling safe with measures being put in place by government.
Well, a sense that you get around here when you interact with the people that are here is that, it's quite normal. They don't feel threatened, they don't feel like, the security is incapable of keeping this particular place safe, In fact, the sentiment that I was mentioning earlier to say that this could have been an inside job was expressed by among those, staff and the people that are coming in for service today to come and get help as they are, could be under the weather. Those that we spoke to, they also mentioned that, they suspect that this could have been an inside job because, a layman on the street could not have figured as to where to locate these copper cables that were actually stolen and how to actually escape without being spotted. But we will hear from the MEC as to what measures they will definitely put in place, as that it's quite vulnerable people whose lives are at risk when this particular incidents actually happen at hospitals. And I must also say that, hospitals are quite secure places where there is security, and it's quite brazen for the said suspects to have entered these premises and done that. And it could have only been the case where, and I'm speculating here, but I suspect it could have been the case where information was shared and they knew exactly where to locate the cables they wanted to take. Desiree.
Ofentse, I don't know if you've put out feelers on the streets, the community of Soweto. What are they saying about this experience at the hospital before and after the incident? Is there any difference?
Well, we are going to engage with the community. We haven't had enough time, unless if maybe we're categorizing the patients as the community itself. In fact, yes, they are wearing both hats. Well, their sentiment is that, there could have been an inside job that actually happened, but they do not feel in any way unsafe when they enter the hospital themselves.